All right, functional friends, let's go ahead and get everybody settled here. Give you guys just a couple moments so we can all get settled. So, my name is Brendan Vermeyer. For those of you that are starting to tune in here, I'm the Director of Clinical Education for Berkeley Life, and we couldn't be more excited to have the opportunity to support the one and only Dr. Tom O'Brien with the inflammation equation, which was such an amazing event. And we are just very honored to have the opportunity to participate. So Dr. Tom O'Brien, who's an internationally recognized functional, one of the GOATs, one of the greatest of all time in the functional medicine space. Dr. Tom O'Brien, how are you doing tonight?
Very well, thank you. Pleasure to be with you, Brendan. Thank you so
Uh,
much for the opportunity.
Oh, no, thank you. I appreciate the fact that you're up at almost 1 a.m. in Italy tuning in to give the audience some of your wisdom here. So for those that are in attendance, thanks for tuning in live. Of course, we are recording. Now, with tonight's format here, we're going to be getting started with a little bit of a presentation. I'm going to give about a 20-minute presentation on nitric oxide science, a little bit of 101 to pique your interest here in how nitric oxide relates to brain health, mental health, cognitive health, and inflammation and inflammatory disease at large. After the brief presentation, then we'll get into some discussion. Dr. Tom will be hosting as we discuss the topic of chronic inflammation and chronic disease and how nitric oxide can play into that as a therapeutic strategy. And then the last 20 minutes of our hour together, we really want to open it up for Q&A from the audience. So as we get started here, please be sure to go ahead and drop your questions into the chat box so that way we can start answering those in the last stage of the presentation. So, Dr. Tom, do you have any commentary?
Yes, just a bit. Thank you. Uh,
Absolutely.
and and I didn't think about this until just now, but in watching webinars, we're listening to the information, we're seeing the slides come up on the screen, and that's kind of okay, that's kind of interesting, and just taking it in. Um, if a question comes into your head when you see the slide, and whether you are light bulb moment type of question or disagreeing with what's on the screen, write it down in the Q&A at that moment. Because I find so often, I don't remember 20 minutes later that question I had 18 slides ago, uh, I often will not remember. So as things come up, if you do that quick jot into the Q&A section, then we'll address it. We'll address it. And this really is not to just regurgitate, but rather to turn on light bulbs, in our minds to, well, what about this? Or what about that? So feel free to ask what you may consider is not a really intelligent question. It doesn't matter. If it comes up, it's important. And that's the message I wanted to start with. If the question comes up in your mind, write it down in that moment.
Absolutely. I couldn't agree more. We really want to make sure that we're giving you guys information that you can hopefully implement, whether it's in your practice, if you're a provider, or if you're a patient, part of your self-healing regimen here. Now, Caitlin, I'm getting a couple comments coming through the chat saying the chat is disabled. So if you guys can just double check to make sure that's working for Tom and I here so people can submit their questions. But with that, let's go ahead and get started here. And as Tom said, don't be shy. Make sure all questions are going to be well received, and we want to make sure we address those effectively here. All right. Okay, so let's go and get started here. So Berkeley Life, we're proud of the work that we're doing in the nitric oxide space. Nitric oxide is really all that we do. We focus on nitric oxide testing, research, and therapeutics here. Now, nitric oxide can be a really big subject. Tom and I were just discussing this a little bit off screen. And as the director of clinical education, my job is really to teach providers and practitioners how to use nitric oxide in their clinical practice. Now, the majority of our audience tonight are patients, and we do also have some practitioners. So I am going to be catering more so to patients with making sure that this information is palatable, digestible, and you can integrate it into your day-to-day life. So we're going to be focusing a little bit more on nitric oxide in relation to brain health and chronic inflammation. Now, certainly my personal favorite area of interest is neuroinflammation, inflammation of the brain. This is something Dr. Tom and I are both very, very passionate about. We speak about this very often. So certainly when we look at some of the statistics of chronic disease and inflammatory disease of both the body and the brain, it's all on the rise, no surprise, but very disturbing nonetheless, right? So of course we know that 6 in 10 Americans have a chronic disease, 4 in 10 have 2 or more. Now we see that Alzheimer's is actually the 7th leading cause of death, Alzheimer's being a chronic neuroinflammatory disorder of the brain. So this is where that chronic neuroinflammation or brain inflammation contributes to the pathophysiology or disease progression, Alzheimer's, Parkinson's, multiple sclerosis. We even now know that even depression, major depressive disorder, and most mental health disorders, neuropsychiatric conditions, can have an inflammatory component to them. Now, I also want to highlight that cerebrovascular disease or stroke is also one of the leading causes of death at number 5. And of course, I think we all know cardiovascular disease. Why I mention this is because nitric oxide is really best known for its role within cardiovascular health, or really just vascular health, because nitric oxide is this miracle molecule that can expand the diameter of our blood vessels, so that way we can have optimal blood flow and perfusion of nutrients, right? So I think most of you here in tuning into the inflammation equation might be battling chronic inflammatory disease. And obviously the whole point of the event and this webinar tonight is, what do we do about that? So I think all too often we maybe overlook the component of suboptimal blood flow being implicated or involved in virtually all chronic conditions. And we have to really recognize and respect that healthy blood flow is ultimately the foundation of overall wellness and healing. Now, of course, why does blood flow matter? Well, a lot of reasons. First and foremost, we have to get oxygen to the cells. So that way we can use our mitochondria, or the powerhouses of the cell, to use that oxygen to make cellular energy, or ATP. Now, further, we transport everything through the blood. If we're transporting immune cells or stem cells, hormones, nutrients, if we don't have optimal blood flow and perfusion into the tissues, we can't get any of these substances or molecules to where we need them to do their healing job, right? So with that, we have to be thinking about, how do we restore optimal blood flow? And especially when we think about mental or neurological or neurodegenerative conditions, there's so much to be said here. Now, I want to keep it relatively simple tonight. And when we look at what happens when we have compromised blood flow to the brain, a lot of negative things start happening, and many neuropsychiatric or mental health symptoms and disorders or conditions can start arising. And if this goes on too long chronically, this can be where dementia and neurodegeneration can also start creeping up on us, right? So with that, without getting too technical or sciencey for the purposes of tonight, one of the first things that happens if we're not getting adequate oxygen to the brain is, like I said, the mitochondria, the powerhouse of our cells, cannot use the oxygen to make cellular energy. When this happens, it causes cellular stress. So this creates what we call ROS, or reactive oxygen species and free radicals. We refer to this as oxidative stress. Just think of it as cellular stress, kind of like if you think about an iron bar that's left outside for too long, it starts to rust as the iron is becoming oxidized, right? This same oxidation rusting effect can happen within our tissues. And this is why we have to have plenty of antioxidants through the diet to neutralize that oxidative rusting effect. Now, part of the problem is that rusting oxidative effect can drive more inflammation, more pro-inflammatory cytokines. So this is just a basic schematic to break that down a little bit. So if we don't have that oxygen getting to the brain, cellular energy in the brain goes down. And how do you think a brain that is rusting, on fire, and doesn't have adequate cellular energy, how do you think you're going to feel cognitively or mentally? Probably not so good, right? It can cause a lot of brain chemical imbalances and dysfunction. This is a more technical graphic, and just why I'm a visual learner myself. So I just want to use this to illustrate some of the points here where we have our blood down here. So plenty of blood flowing through the body all the time. And then we have this blood-brain barrier, which is a line of cells that separates essentially the functional tissue of the brain and central nervous system from the rest of our body. Now, under normal healthy conditions, we should have these tightly packed cells to prevent naughty microbes or toxins, metals from leaking into the brain. But under more low oxygen or inflammatory conditions, we can develop what we call leaky brain, where the blood-brain barrier is compromised and cytokines, immune cells, toxins, pathogens can start leaking into the brain. That drives more brain inflammation and dysfunction. Now, what's interesting about this schematic is nitric oxide is actually made by all these different cells illustrated here. And we're going to talk more about what nitric oxide is really doing, because it can exert many, many effects in the body, right? So as we move this forward, how do we really properly restore optimal blood flow and perfusion? Well, this is where enter this miracle molecule that is nitric oxide that actually won the Nobel Prize in 1998 for its discovery as this pleiotropic or multifaceted signaling molecule within the cardiometabolic system. So mostly when we think of nitric oxide, we're thinking of cardiovascular health, blood pressure, blood flow, but it's really so much more than that. So of course we use it to deliver oxygen to target tissues, but it also regulates the blood pressure, as I just alluded to, or the mitochondrial oxygen consumption, which is how our cells produce energy to do all the amazing things that our cells do. Also, nitric oxide is used to fight off infection. It's used as an antimicrobial molecule by immune cells to fight off foreign invaders. I actually just had a viral infection recently. I was traveling, came back kind of sick, so I was down for a few days, but my immune system is producing nitric oxide to fight off the infection. It also can play a function as a neurotransmitter and actually regulates the release of some of our other feel-good neurotransmitters like serotonin and dopamine and GABA, right? So nitric oxide plays such a critical role in all of these processes. Now, with this slide, I really just wanted to highlight that nitric oxide dysregulation or imbalance is actually involved in virtually all the leading causes of death. And it can be a little bit nuanced, it can get a little bit complex, but these are 9 different references to show how nitric oxide plays a very critical role in all of these chronic conditions. So we don't need to go into all the biochemistry, but I do just want to simply illustrate that nitric oxide research has come a long ways. In Berkeley Life, we're really on the precipice of nitric oxide research, and we are actively contributing to advancing nitric oxide research. I'm also the director of clinical operations, so I oversee all of our research studies that we're doing with various research partners. Now, traditionally, a lot of times when people think of nitric oxide supplementation, they're using an L-arginine-based product. So the amino acids make up proteins. There's a specific amino acid that is L-arginine that can be used to create nitric oxide in the body. This is known as this nitric oxide synthase pathway. It's enzyme-driven. A lot of things can go wrong with this pathway. And to keep it simple and succinct for tonight, I would really argue that most people would not benefit from taking an arginine or citrulline-based product, especially anybody with a chronic inflammatory disease. It has to do with this dysregulation or uncoupling effects that can happen with the nitric oxide synthase enzyme. So what we want to do instead is skip all of that dysfunction that can occur by leveraging what we call the nitrate pathway. Now, nitrate is actually a dietary nutrient that we get from dark green leafy things. So, to the audience, how many of you are eating plenty of dark green leafy salads or eating beets or green juice? Because these are really our best dietary sources of nitrate. Now, you can think of nitrate kind of like the storage form of nitric oxide. Because nitric oxide, it's a gas with a very, very short half-life of like 3 milliseconds. So it's poof, gone like the wind. It dissipates as a gas. It can travel through our tissues very easily. But as soon as it's made, it'll quickly become oxidized back into nitrite or nitrate. So for simplicity's sake, think of nitrate as the storage form, the circulating storage form of nitric oxide, and our body can reduce it and convert it into nitric oxide when we need it on demand. So at Berkeley, what we're really doing with our product system is we're testing salivary levels of nitrite as a surrogate marker, because you can't really measure nitric oxide directly. So we have to measure the storage form that's circulating in the plasma and saliva. We actually concentrate a lot of nitrate in the salivary gland. So it makes salivary testing non-invasive, no blood draw required. You get an instant reading within 10 seconds using the test strips. And depending on how pink your test strip turns, that tells us how much nitrate we need to pump into your body. So that way we have adequate storage form of nitric oxide to make this miracle molecule when we need to, right? Now, unfortunately, as we age, we undergo cellular aging, which is known as senescence, right? So as we age, our cells start getting a little bit more worn out and rusting and inflamed. So unfortunately, we lose a lot of our nitric oxide producing capacity as we age, so much so that by the time we're 40, it's estimated that we're only at about 50% of our capacity to produce nitric oxide. And this also means that the risk of cardiovascular diseases can go up and up and up and up. A good example is women going through menopause. When their estrogen and progesterone and testosterone start crashing down because of menopause, estrogen in particular is extremely important to stimulate nitric oxide production. So we actually see that women going through menopause, their risk of cardiovascular disease or high blood pressure goes up and up and up because they don't have enough estrogen to stimulate nitric oxide, which opens up those blood vessels so blood can flow optimally. So this is why we're all about this here at Berkeley Life. And with my job as Director of Clinical Education, I like to say that if you have a pulse, nitric oxide is for you, right? So the best thing that we can really do is make sure that we're giving your body the raw nutrients, the substrates to make this miracle molecule when needed here. So there's a lot of different ways that nitric oxide plays a very critical role in our cognitive health, our mental health, neurological health, through its different signaling effects, like I alluded to with acting as a neurotransmitter and regulating some of our other happy hormones in the brain, making sure that we keep neuroinflammation at bay. So it actually regulates the inflammatory response in the brain, as well as that rusting effect with the oxidative stress. It also keeps those tight junctions in the blood-brain barrier nice and tight. So we have a sealed blood-brain barrier. We don't have any nasty toxins or pathogens leaking through. So some things that you guys should be looking for in your patients or yourself, if you are a patient or self-healer, the most classic thing would be high blood pressure, right? That's probably what nitric oxide is most famous for, is helping to keep high blood pressure in check and reducing blood pressure by expanding the diameter of those blood vessels. But also things like sluggishness, exercise intolerance, fatigue or chronic fatigue, neuropathy, numbness and tingling, cold hands and feet, sexual dysfunction. There's so many different clinical presentations or symptoms that could be in part due to an underlying nitric oxide imbalance or deficiency. So succinctly, by supporting optimal nitric oxide, we can help everything else work better in the body by restoring that optimal blood flow and perfusion. So as I alluded to, we have these non-invasive salivary nitrite test strips. I like to have all my clients keep a tube at home. It's a great accountability and compliance tool, right? Because a lot of supplements you don't really feel too often. This one you do feel, and you can also see that it's working by taking the test strip baseline, supplementing with the nitric oxide product, and then retest your salivary levels about 90 minutes later. And you should get a nice increase from more of a low or depleted white reading on the test strip to more of a target threshold. So it's a chemical reaction going on this salivary test strip, and very simply tells you where are you at, and that allows you to know how much dietary nitrate do I need. Now, personally, hey, I think it's great if we can get most of our nutrition from our diet, right? So I do my best, right, to eat plenty of dark green leafy salads, your spinach and kale and arugula and bok choy, maybe some beets on there too. I personally do a lot of green juice and try to get a lot of nitrate through green juice. But hey, for people that might not be eating enough dark green leafy things, the dietary nitrate capsules are a great way to go to make sure you're still getting that necessary nutrient to promote healthy blood flow and nitric oxide signaling. So this is our product line as I start wrapping up this brief presentation, and we'll have Dr. Tom join us in a moment here. So again, to simplify this product line, we're testing salivary nitrite, we're supplementing dietary nitrate, and all of this is to promote optimal nitric oxide for healthy blood flow and signaling throughout your entire body. So with that, I think that's a good 101 to kind of open up this presentation here. And now we'll talk to Dr. Tom a bit. And then like Dr. Tom said, don't be shy. Make sure to drop those questions in the chat box because we'll open it up for some Q&A. All right.
Well done, Brendan. Well done.
Thank you.
A little geeky, a little bit.
I tried to dial it back, my friend.
I know, and you did a good job, but sometimes it's difficult. There's a couple of things I would begin with saying, and the first is, this is one of those molecules that's essential. And the way that I like to describe it for people is that when you look at how many blood vessels are in the human body, it's literally thousands of miles of blood vessels. Your blood vessels start, the largest blood vessel is the aorta that's in the center of your chest. Let's say it's the size of your thumb. It's not quite that big, but it's pretty close to the size of your thumb. It branches into two blood vessels that are a little bit smaller, that branch into two more blood vessels that are a little bit smaller. And every branch is just a little bit smaller until they're so small, one red blood cell can squeeze through at a time. And those are called arterioles. They're the smallest of the artery blood vessels. Then they start expanding again into a little bit bigger, a little bit bigger, a little bit bigger. Now it's the veins, and the veins are carrying away the blood from the cells and the exhaust or the waste of the cell doing its job, whatever it's doing. But the blood vessels, this concept of the size of the blood vessels is really important. Why? Okay, so you're saying that there's thousands of miles of blood vessels in my body. Yes, there is. Okay, well, that's kind of a hard one for people to grasp sometimes. But for now, if you just accept that there is, how is it possible that a pump the size of your fist, your heart, how can a pump the size of your fist pump through thousands of miles of blood vessels? It's impossible. There's never been a pump made that can do that. It's impossible. But your heart does it 24/7 for 70 years, 80 years, 90 years, nonstop. It keeps doing it. Well, how does it do that? If you take a garden hose and you step on a garden hose, there's a squirt of water that comes out the end of the hose from that pressure, right? And the heart pumps the blood out into the larger blood vessels, the aorta, pumps it out. Okay, how does the blood continue in the arteries? It continues because it does the wave, like in a stadium, a football stadium. You know how everybody stands up and then they sit down and they go around the stadium with it, that wave thing? That's what your blood vessels do. The heart squirts out a little bit of blood and the blood vessels go, whoa, whoa, and they just keep pushing the blood further along in that wave format. Nitric oxide is critical to the wave. That's a way of thinking about it. It's just critical. And if you have low nitric oxide, your blood vessels get stiffer. They're not as elastic. They're not as wavy, if I can use that term. And that's why every cell of your body benefits from having adequate amounts of nitric oxide. So that's a visual that I hope will help some people. The next thing I wanted to say is that there are very few things that you can tell immediately whether you and your family are getting enough of something that's good for your body. There's very few things, but this is one of them. These strips, you just put a strip on your tongue or under your tongue, you get some saliva on it, you fold it over and wait a couple of seconds, and that the little felt pad on the end of the strip where the saliva was, it touches the other side, and then now it changes color. And that color change is related to how much nitric oxide or how much nitrates you've got on your tongue. And so it's a simple way of telling, do I have enough right now? And I would suggest that you get the test strips and you check your whole family, and you're going to find, if you're a family of 4, at least 3 of you, if not 4 of you, are low. And so what does that mean? Well, do I have to take this nutrition? Well, yeah, for a while, it's like, especially nitric oxide is this way. If you go to a country house, an old country house, and they've got those hand pumps, for the well, to get water up, and you start pumping this thing and it's not been used in a few months and there's no water coming out. Sometimes you have to unscrew the cap and pour some water down there. And then you screw the cap back on, and then it lifts the water up, and it creates that suction and now the well works. You have to prime the pump. And taking nutrition can prime the pump. So when you do the test strips and you find that you're low, then you take the nutrition while you're saying, okay, so, and this is diet related. So what are the foods that I need to start eating more of? But you take the nutrition to get it up, right? You notice within a couple of days, maybe a week, that all of a sudden things are working better than they've worked in a while. And if you stop the nutrition, you go back to the way you were, right? Until you transition your diet into eating more of the foods that will give you that raw material to make your own nitric oxide levels. I think this is a great product. I think this is an excellent concept. You keep these test strips in your medicine cabinet, and like maybe on the first of every month, you check the whole family, because you aren't going to remember to do it every couple, 3 days when they're low, but at first maybe you will, but then life gets busy. But if you get in the habit, the first of the month, everyone's just before dinner or something, come here, stick your tongue out, here, put this on there, give me some saliva. But you check it monthly, and then you'll discover, as you're transitioning your diet into more foods that support nitric oxide production, there's going to be one member of the family, maybe 2, that aren't quite getting it done and require continuing on the supplementation. So I wish every important substance in our body could be tested so easily.
Me too.
This is excellent. It's just excellent that you've got this simple test that everyone in your family can do.
Yeah, I was thinking that earlier, is I wish we had a test strip for virtually everything, rather than doing, because you can only do a venous blood draw like every 2 months on the soon side, more like once a year, right? So having something non-invasive that you can do right at home, get a reading in seconds. I've heard some use the analogy of kind of like testing your pool chemicals. You dip the stick into the pool to see what the different chemicals in the pool are like.
Right.
And to Tom's point, we can use the strips, get an idea of where you're at, and then we know what nutrition you're really going to need to get your levels back up. Check it every now and then, like the oil in your car. Good to go.
Yes.
Awesome. So we have some good questions starting to roll through. Tom, do you feel ready for some Q&A?
Sure, you bet.
Awesome. So for those in the audience, a few people commenting on the chat box. So direct all the questions to the Q&A box, which is different than the chat box. So that's where we'll field those. Now, one of the questions, we'll kind of play ping pong here. So Dr. Tom, one person is asking, can you please recommend what is the best place to check for nutrient deficiencies, or any lab testing recommendations for vitamin mineral deficiencies?
there are a number of laboratories that have really good comprehensive tests for that. The one that we are currently using at the dr.com is called the micronutrient panel from Vibrant Wellness. I've been working with Vibrant Wellness quite a bit in the people that we're working with, and we find these tests to be extremely accurate. I started doing this, when was this? 2012, I think it was, with gluten. You know, as you may know, I cut my teeth on learning about gluten sensitivity and teaching about that out in the world. And too often people would do the test for sensitivity to wheat or to gluten, and it would come back negative, but they'd say, but I feel better if I don't eat wheat. And that was always pretty confounding to us. You know, we didn't, well, if you feel better, then don't eat it. Okay, but your immune system's not fighting wheat. But the laboratories were only offering a test that looked at one particular peptide or piece of wheat, and it was called alpha-gliadin. And 50% of celiacs will have elevated blood levels of alpha-gliadin, but that meant immediately that 50% don't. So wait a minute, we know with celiac, as an example, it's a sensitivity to wheat. So how come the test is negative? Well, you know, it's just, no, it's the test. I mean, there are 62 different peptides of wheat that stimulate your immune response that we know of. 62. Well, why are you only testing one, laboratory? And no one had an answer for that. Vibrant came out. They opened in 2016. And Mayo Clinic wrote a paper that talked about a new era in laboratory medicine, a completely new era in laboratory medicine, called silicone chip technology. And it was highly, highly accurate. And you could look at 6,000 different markers in one blood draw. It's like, what? I mean, that's paradigm changing. And we started using Vibrant's technology, their laboratory tests. I have to back up. One of the things I did starting in 2012 is that I would do a double blood draw, meaning I do a venipuncture, but I take 2 tubes of blood instead of one from the same blood draw. And the first tube, label with the patient's name and then send it off for whatever test we were ordering. But I take the second tube and I'd label it Joe Smith and send it to the lab ordering the same test in a separate envelope. And I had to pay for that. You can't charge the patient and you can't charge insurance. And consistently, they'd come back substantially different. Maybe three out of 10 times, they would come back substantially different. And I wouldn't know which test result to talk to the patient about, the one with their name on it that was normal, or the one, Joe Smith, that was, whoa, there's a problem here. And this happened 3 out of 10 times. And I did maybe 15, 20 different patients like that, you know, and I had to pay for it myself, but I want the best for our patients, right? And then when Vibrant came out with the silicone chip technology, I did the same thing. And it never came back 3% different, something like that, but not 25% different, not 30% different. And so that convinced me to trust the technology of what Vibrant is doing. So that's the lab that I use, but some people use SpectraCell for their nutrient testing. Some people will use other labs. As a practitioner, you want confidence. Well, practitioners don't want to talk about this, actually. They don't want, because they don't want to spend the money and get the confusion of, well, no, my labs are accurate. How do you know they're accurate? Have you ever checked to see if they're accurate? Well, they tell me they're accurate, you know. So it was a clinical conundrum for us for many years. And I don't have that anymore with Vibrant. I've got confidence, and I've seen a number of research papers, and I've also done double blinds. I've done 5. I did 5 double blinds with Vibrant, and I said, all right, because every time it comes back within 2 to 3%. So I've been really happy in my clinical practice with that one. Brendan, do you have some additional information on that?
I would corroborate what you said. I love Vibrance technology. I did go through your certified gluten practitioner course back in the day and found it to be tremendously helpful. And there's so many great labs out there doing great work, Genova and Cyrex, but definitely Vibrant has really done an exceptional job. And especially what I love with Vibrant is how many different assays you can run together with their packages and everything. Because you can get like your wheat zoomer, you can get your micronutrient test, or so many others. They've got an amazing tick-borne panel for Lyme and stealth infections, or mold, toxins, heavy metals. I feel like Vibrant's kind of become that one-stop shop for functional lab testing. So fully agree. All right, let's see here. Next question. So I'll take the first stab at this one and I'll throw it over to Tom, see what he thinks. So the question is, how can you determine or test for my existing baseline nitric oxide levels, and what is optimal level of nitric oxide, and what is that range? So just to speak to that briefly, of course, we're really using the salivary nitrite test strips. Now, I didn't, for the sake of time, I didn't go too into it, but one of the pearls with this, and we have done our own research in-house, well, actually in partnership with Dr. Jason Allen at the University of Virginia. So we have proven that the test strips are very accurate and relatable to plasma levels. So we actually did a study looking at duration of effect of the supplement. And what we were looking at is plasma levels or blood levels of nitrate and nitrite, along with salivary levels, along with salivary test strips. And it was very consistent across the board. So you can measure nitrate or nitrite in the blood, although I don't know of a commercial biomarker for that, but it can be measured in, a specialized laboratory with specialized equipment. But the point being, the non-invasive test strips are a great way to go. And as Dr. Tom alluded to, it's simply a color change that happens on the test strip. So it makes it very easy to just spot check to see where you're at. Dr. Tom, any thoughts on that or other information that might be pertinent?
Yeah, not other information that's pertinent. I've never done serum testing or urine testing for nitrates and nitrites and nitric oxide. Well, for nitrates in the urine, that's simple. It's an easy dipstick, but not for nitric oxide. When these test strips came out, it was a godsend. I've always wanted our patients to have home testing available whenever they can. Back in the early 80s, we started using something from Metagenics at the time called zinc tally. And it was a solution, you pour a little bit in the cap, and you put in your mouth, and the normal reaction is, oh, what's that? But that's normal. The worse it tastes, the better for you. But we tested every new patient for that, and consistently, maybe 6, 7 out of 10 times, it came back and said, well, it tastes like water. That is strongly suggestive, with some pretty good science, that there's a zinc insufficiency in the body. So we would recommend zinc to the person at the time, give them a list of foods that are high in zinc, and we give them a bottle of zinc tally. And once a month, Mrs. Patient, on the first of the month, open up your medicine cabinet, pour a little cap, and test the whole family to make sure zinc levels, especially with the flu season, because zinc's critically important to your immune system. So giving patients home monitoring that they can do, and guiding them into a time frame of how often, first of the month, everyone gets tested for zinc, everyone gets tested for nitric oxide. Just simple things like that make it easy for people.
Absolutely. And there's so many new, non-invasive at-home things we can do with the zinc or the test strips, blood pressure, heart rate variability with, Oura rings and stuff like that, all these wearables. We're actually currently getting started with a new clinical trial Relatively large cohort too. And what we're going to be doing is tracking their HRV while they take the product. So that should give some interesting data
Marvelous.
to see how does nitric oxide promote balance within our nervous system. That might be pretty cool. So we'll check back on that maybe in like a year when that clinical trial wraps up.
Marvelous.
Let's see. And then to the person that was asking for that test, that was the Vibrant micronutrient test. I put that in the chat box. So you can check that one out. And then let's see. Yeah, this is, yeah, go
While you're
ahead.
looking for the questions, there was a visual that I wanted to give people from your presentation. It's an excellent summary that you did. And I've often used this example about a lack of blood flow into the brain. So if everyone could cross your legs for a minute, please, unless you're driving. If you're driving, don't do it. But if you're sitting, please cross your legs for a minute. Leave them like that for 3 hours. Stand up and run.
Mm.
You can't, right? Because you cross your legs for a long time, blood flow's not going into the leg very well now, and you try and stand up, you may get some numbness or the leg goes numb, right? You got to get blood back in there again. That's what happens to your brain when you don't get enough blood flow. It's like your leg went to sleep. Some of your brain cells go to sleep. It's called hypoperfusion. Geeky word, but it means a lack of blood flow. Now, the science is really clear. 73% of the people with the sensitivity to wheat, you test positive for wheat, 73% of those people have hypoperfusion into the brain. Okay, well, what does that mean? It's like your leg's numb. You know, some area of your brain is numb. And it just depends on what area it is, whether you manifest as depression or as migraines or as seizures or as schizophrenia. Just Google schizophrenia and gluten, and you see the studies coming up that for some people, it makes a world of a life-changing difference, or depression and gluten, or seizures and gluten. Look, I read this study early on in the journal Gastroenterology. 50% of children with drug-resistant epilepsy, which means by definition, they've tried at least 3 medications and they don't work. 50% of those children go into complete remission on a gluten-free diet. They're not celiacs, but they go in complete remission on a gluten-free diet. Well, why don't our neurologists know this? Because it's in the gastroenterology journal, and neurologists don't read gastroenterology journals. My point is blood flow is so critical for every cell of your body. And we talk about the topic of the brain here. And just like crossing your legs for 3 hours, that when you've got a lack of blood flow going into the brain because you may have low nitric oxide levels or some food sensitivities, it's like you've got a numb leg. You can't stand up and run. You can't perform. Your brain function is compromised. So that's a geek word, hypoperfusion, but I hope it helps to give a picture of what happens in your kidneys or in your liver or in your brain when you don't have enough nitric oxide.
I love that. Lot of amazing information there. And this question is kind of a follow-up, so I'll go with this one and then we'll answer some of these others. But Tom, this person's asking that can hypoperfusion, as you were just speaking to, hypoperfusion to the brain, can this cause tics? And what if somebody's gluten-free and they still have tics? Any thoughts on that?
Yeah. Oh, certainly it can. And and as a CGP, you know this, Brendan, when people go gluten-free, if they then do the Vibrant Wellness Wheat Zoomer test, which I believe is the most comprehensive, accurate test on the planet, you do that test and it comes back positive. You say, but I'm gluten-free and I've been gluten-free for months. Well, not enough. You know, there's some hidden exposure you're getting. So before you say, okay, I've gone gluten-free, but my child still has tics, you have to do the test to confirm what you're doing is working. And the beauty of this test, you don't have to do a blood draw. You can do a finger prick, and it's just as accurate. Vibrant has that technology now. So for that person who is asking about ticks, yes, absolutely. And there's a lot of good science behind it that may be caused by sensitivity to wheat. It certainly is caused by a lack of blood flow into an area of the brain causing that. So I would recommend you do, if this is for a child, you do the finger prick wheat zoomer to confirm what you're doing is working. If it is working and your wheat zoomer is normal, congratulations, what you're doing is working. The next thing I would look at is the lectin zoomer.
Mm.
So when you do the finger prick, just do both at the same time. Because it's so very common that lectins are a backup contributor. My experience, and maybe it's because I'm always looking for it, but my experience is wheat sensitivity is a very common trigger for ticks, but lectins are not far behind. So you certainly can check that one also.
Good insight. Good insight. I'm guessing this is probably coming from the same person because she's asking, or they're asking, would you recommend nitric oxide to a child who has ticks? I'm curious your thoughts.
Yeah, without hesitancy.
Yeah.
First, I'd probably do the test, the little strip, get the saliva test done so that you have some evidence here. Say, wow, look, there's no register of nitric oxide at all. Okay, let's get started with that. But yes, I would, without hesitating.
Love that. And to the audience, the comparison, I'm the guy that all the tough questions go to when when our customer service team doesn't know how to respond to an inquiry, whether it's coming from a doctor using our products or a patient. And one of the questions that I do often get with our support hotline is, contraindications, or, is it safe for this condition or that condition? To kind of put it into context, dietary nitrate is really the nutrient that we're talking about here. And this is the same nutrient that you're going to get from a dark green leafy salad or a green juice or some beets, right? So anytime people are asking, well, can I take this supplement if I have multiple sclerosis or, heart disease or thyroid or whatever it is? My answer is always, would that person feel safe eating a dark green leafy salad? And if so, then yes, you should also feel safe with this. Now, as far as, contraindications, we really do not know of any true contraindications. There are a few clinical scenarios that we want to be a little bit more cautious, and that's going to be hypotension or low blood pressure. AFib is one. Anybody on blood pressure drugs or blood thinners, these are types of situations where we might want to titrate more slowly. Titrate as in make sure that we're being methodical with working our way up on the dose. But as I said before, the test strips guide the dose. So if you do your test strip and you're really, really pale or white, go eat a salad, drink some green juice, take a capsule or two, retest in about 90 minutes, and that'll give you an idea of how much nitrate your body needs individually. All right, so we have just about 10 minutes here, and we will do, hard stop at the top of the hour because Dr. Tom needs to get his sleep so we can make sure that his brain function is on point. He's feeling good the next day. So this last 10 minutes here, don't be shy. Go ahead and drop those questions, but we'll start wrapping up here. Now, let's see. This is an interesting one. So it says, for someone with risk of hereditary dementia and also risk of brain microbleeds, is there a concern about boosting blood flow?
That's a really interesting question. The first thing I would want to do would be the wheat zoomer, because it includes the most comprehensive test for intestinal permeability that I've ever seen. And if you do come back positive to leaky gut, we can assume leaky brain.
Yep.
So I would do the wheat zoomer and the neural zoomer plus, which is also from Vibrant, that looks at 53 markers of inflammation in the brain. And there are a few markers in that neural zoomer plus that are specific biomarkers of a breach of the blood-brain barrier, a leaky brain. If you test positive for leaky gut or leaky brain, then you begin the protocols to start to heal that. And the first thing is making sure you have adequate amounts of butyric acid or butyrate, same thing, being produced in your gut. Well, how do you know that? Well, you do this, the gut zoomer to see what's your butyric acid levels, or another test to see if you have enough butyric acid, because butyric acid is a primary healer of a breach of the blood-brain barrier, the leaky brain. So identify, do you have any evidence of likely leaky brain? If so, address that. How do you address that? There are a number of things that are important, but one of them, perhaps in my opinion, the most important one, is having adequate levels of butyrate. And I don't mean adequate's the wrong word, abundant levels, meaning you have a nice, diverse, healthy microbiome that's producing. Butyrate is produced by the good guys in your gut. And it's one of those healing substances that seals the leaks in our barriers, the gut barrier, the brain barrier, the lung barrier, the kidney barrier. The butyrate is critically important for all of those. So I would want to make sure you have abundant butyrate levels.
Absolutely. And so many different valuable tests there that we can get that insight. And with that butyrate, you know, making sure that you're eating plenty of fibers. And one of the things I didn't mention in the presentation, but nitrate, dietary nitrate, the nutrient that's the star of this show, it does have a prebiotic-like effect, which is really, really cool. So nitrate by itself can increase the growth of the good guys in our gut that are producing some of those short chain fatty acids in the butyrate and others to help seal up those tight junctions. So another fun fact there.
For our audience that is general public, what you just said, a little bit geeky, so I just want them to understand, a prebiotic is a food that feeds the good bacteria in your gut. And so taking that's why it's really important to eat root vegetables because they are prebiotics. And the easiest thing, what we tell patients all the time, is just go to Google and type list of prebiotic foods. Garlic's a prebiotic, onions are a prebiotic, bananas are a prebiotic. You don't have to eat all these weird foods like chicory, right? I mean, you can if you like, but there's a lot of normal foods that are prebiotics. And when you have an insufficiency or a deficiency, you supplement for a few months with prebiotics so that you're feeding and encouraging more of the good guys to develop in your gut. And prebiotics only feed the good guys. They don't feed the bad guys. So you supplement to help the good guys get stronger to make their exhaust, butyrate, butyric acid, and the other short chain fatty acid, to make the exhaust that goes into your bloodstream and helps to heal the leaky brain, the leaky gut, the leaky kidneys, whatever the tissue is that needs some healing.
Mm-hmm. Love it. So this one, we'll probably take maybe a couple more here. I'll take a stab at this one just because it's very specific with asking about other supplements be taken with the nitric oxide product, specifically molecular hydrogen and methylene blue before red light therapy. So there's multiple components to this question. It might have a biohacker here. Now I will just make a note. First off, I love molecular hydrogen. I'll be curious what Tom thinks about this. And I get the methylene blue question all the time. So simply, nitric oxide and molecular oxygen can both decrease blood pressure. I kind of found that out the hard way, actually. But molecular hydrogen and nitric oxide, they both have similar properties. They're both gases in the body, but they can both decrease blood pressure. So if you're doing nitric oxide and molecular hydrogen, that can sometimes make you almost too hypotensive, start getting woozy and dizzy. I was at the gym, laid back on the bench to do a press, and you know, this ceiling was spinning. I'm like, I don't think it's supposed to do that. So I would just urge a little bit of caution if you're combining the nitric oxide with molecular hydrogen. Now, methylene blue, that's a nuanced one. And I will just keep it simple by saying, methylene blue has kind of become all the rage. It's a dye, and people are using it as like a brain supplement and mitochondria energy support supplement. Methylene blue and nitric oxide have both synergistic, as in they're working together to help you, but also have some antagonistic, as in they're opposing. So I think that's one that you have to be careful with, because it doesn't make a ton of sense to take two substances that are kind of pulling you in two different directions, but there is also a little bit of synergy there. So I would just maybe urge a little bit of caution around that. Red light therapy does stimulate nitric oxide, as does nasal breathing. Tom and I were talking about yoga before we got started with this webinar, and that deep pranayama, nasal diaphragmatic breathing, that deep belly breathing that we do so much in yoga. We have more receptors in our nasal passage that stimulates nitric oxide production. So when Dr. Tom was talking about, low blood flow to the brain and crossing your legs and trying to get up and run, that brain fog, that malaise, if you will. Now, with that, you think about like anxiety or panic, right? I just watched Inside Out 2, which was a beautiful, beautiful movie. And, it featured the anxiety character. With anxiety and panic, a lot of times we're breathing up in our chest and hyperventilating, right? And how do we remedy that? We try to slow down the breath. We try to belly breathe. And part of what's going on there is it's actually stimulating more nitric oxide, more blood flow. So one of the top symptoms you see with people that don't have adequate blood flow to the brain is this kind of anxiety and this panicky feeling, right? We need to reoxygenate the body. Tom, how do you feel about molecular hydrogen and methylene blue? They've kind of become all the rage these days.
Yeah, I would agree with everything you said on molecular hydrogen, and I've just never touched methylene blue.
Yeah.
I think it's kind of I've not seen enough evidence that it's worth pursuing. I guess I'd leave it at that.
Yeah, that's perfectly fair. I never have gotten super into it, but I had to do some digging just because I kept getting the question. I will say, Dr. Nathan Bryan, who is a nitric oxide researcher, he will often have a more kind of antagonistic view where he will candidly say, we use methylene blue to inhibit nitric oxide in the lab. So that's his words. Some of the research shows some synergy, some antagonism. So, teach their own there. The red light therapy, I'm all for that though. So, one real quick, Dr. Tom, what was the zinc, the at-home zinc taste test? Somebody's asking about that one.
Zinc Tally was the product. I don't know if Metagenics still makes that product or not. I just don't know. I've not looked in a few years.
Yeah, I was going to say, I'm trying to remember. I'm trying to think of like what the chemical form of the zinc was. I used to use that stuff with my clients, that metal taste, but all right. So this was a really amazing webinar. We're right about at the top of the hour. So just out of respect for Dr. Tom's time, I'm going to go ahead and wrap us up. Now, certainly for those of you that submitted questions, we can try to facilitate doing some wrap up on the backside. We want to make sure you guys feel very, very supported. But certainly, thank you so much for tuning in. Make sure to share the information with your loved ones. But a big thank you to Dr. Tom and his whole team with this amazing inflammation equation event that they've put on at Berkeley. We're just very excited to be a part of it. So Dr. Tom, I'll turn it over to you if you have any closing remarks for us.
Oh, thank you so much. I've just one moment. I'm bringing up on my screen the handout that we had put together on the zinc taste. It's zinc sulfate.
Yeah.
And I will put this handout in the chat if I can. So can you give me a moment here to okay, to do that? Let's
Absolutely.
see. Can I do that? Yes, I can. Let me see here. So it's in my Dropbox. And oh no, it won't allow me to do it. I will send it to you so that you then can have it posted or available. And anyone's welcome to use the handout, tweak it if you want. or use it as if you want to use the zinc sulfate solution. Closing comments. Thank you all for being here first. Thank you so much. It becomes so critically important to me to make sure that we're doing whatever we can to share education, share knowledge, and that a top priority in my world, I've seen it so many times, and you heard me throughout the inflammation equation say 14 of the 15 top causes of death are chronic inflammatory diseases. It's always inflammation. If we put our attention on monitoring our inflammatory state and reducing the triggers of our inflammatory state, you get such bang for your buck in terms of the time that you're putting into being healthier. What are the triggers for you of where inflammation is coming from? And using these little strips for identifying your nitric oxide level is such a simple way to have adequate amounts of a big fire extinguisher in your body. It's really a no-brainer, you know, when you read the science that's why I invited Berkeley Life to be one of our sponsors at the inflammation equation, is because I believe in my heart and soul that this is a valuable tool that will help you and your family move forward in reducing your inflammatory state, making sure that your blood vessels are doing the wave. That's such a good visual, and it's so true. I mean, it's just so true. So thank you so much for the opportunity to be here. Thank you all for attending. And Brendan, I'll pass it back to you.
Absolutely. Thank you, my friend. It was a pleasure to have the opportunity to host you, and I hope to see you at some events this fall, hopefully.
Yes, thank you. Yes.
Awesome. To the audience, I hope you all have a great rest of your night. Thank you for tuning in. We've got it recorded. We'll follow up via email. Tom, get some sleep, my friend. We need your brilliance in the world. So thank you all and have a great night.
Thank you, everyone.